Hi, my name is Mark Lurie. I'm the co-director of the Sash program. With Chris Colvin, we started the Sash program about 2 years ago. Started with a proposal that we wrote to get funded by the NIH to put together this collaboration between the University of Cape Town and Brown University aimed at training the next generation of social scientists who are able to deal effectively with the HIV epidemic in South Africa.
So I'm Chris Colvin. I work at the School of Public Health and Family Medicine at the University of Cape Town, where I run the Division of Social and Behavioral Sciences.
My name is Caroline Quo, and I'm a faculty member based at Brown University School of Public Health. And I also hold a joint appointment at University of Cape Town. And I have the pleasure of leading the Sash initiative with excellent colleagues in South Africa and also in the US.
What we're trying to do with the Sash program for students is really to provide a space where they can get a lot of the advice and mentorship and professional development kind of input that is really hard to find in a lot of postgraduate programs.
I think for students, Sash is an opportunity that they may not get elsewhere. This is a structured environment where student fellows really have an opportunity to interact with academics both from the US and from Cape Town and to receive meaningful ongoing feedback and input into the work that they're doing. So I think for a regular student doing their work, they may really just have limited access to those kinds of mentors, but our program is structured to really give people ongoing and in-depth mentorship through all the processes of doing research from beginning to end.
I think the other piece about Sash that's been important for our scholars has been the space to bond with other talented scholars in a similar career trajectory. And those relationships, I think, are the beginning of magic that will begin to coalesce and strengthen the rigor of HIV social science in South Africa as their careers move on.
I think one of the things we try to do with Sash is we have a particular focus on trying to develop interdisciplinary work. Not only interdisciplinary work, say, within a faculty, but ideally across faculties.
Our program is an attempt to really bring together all of these different voices that are working within this field because we believe that learning and understanding and collaborating with people from many different areas of social science is likely to yield the kinds of results that we need. You know, the kinds of problems that we look at, the HIV epidemic, this is an extraordinarily complex set of issues, and if you come at it with one limited approach, then you're only going to see a small part of the puzzle. And so what we're trying to do here is to add a kind of social science perspective to the real understanding of the epidemic.
Sash has offered us the opportunity to institutionalize and formalize and coalesce a number of very fruitful partnerships that have occurred between South African and US team members. Before Sash, I think that our scientific collaborations were occurring in different silos and very productive, but occurring in these different silos. And Sash has really allowed us to think thoughtfully about how those different teams can come together into a very strategic approach towards HIV social science.
For the partnership with UCT and Brown, it's a chance really to move beyond the kind of narrow instrumental focus on a research project. Many times when universities collaborate, they work together on very specific projects, which is great for the project, but when the project ends, the collaboration is over. And the way that the program is designed, it really gives us a lot of breathing room in a way to try to develop that partnership and collaboration in ways that kind of feel right and in ways that you can't always predict at the outset.
I think one of the wonderful things about Sash is that it improves the environment both at UCT and Brown. This is a collaboration between the two institutions, but it's not about one institution giving advice to the other. It's a real collaboration where we're working to improve the social science environments at both places. I think really more than anything, our aim, and I think we're succeeding in this, is to really strengthen both institutions through this collaboration. I think we've done remarkably well with that.